So, welcome to Prescription for Primary Care. I'm Ryan Cho, and today we're joined by April Susin, the president of Nurse Practitioners Association of Nova Scotia. April has been a nurse practitioner for 11 years, and prior to that, she spent 10 years as a registered nurse. She has a background in geriatrics and in primary care, and she currently works full time in Dalhousie University and in the gynecology clinic at the IWK. She is also currently completing her PhD at Queen's University. April, thank you for being here.
Thank you for having me. I'm really excited.
So let's get right into the state of primary care. According to recent data from March 2024, over 156,000 Nova Scotians are on the Need a Family Practice Registry. How are nurse practitioners helping to address this access crisis?
There's been a lot of growth of NPs over the last several years. During this time, nurse practitioners have risen to the occasion to help bring quality care to Nova Scotia residents. For example, NPs jumped in to provide care at Northwood during the COVID outbreak, and NPs are providing 24-hour care in our neonatal intensive care unit at the IWK. The majority of providers who work for virtual care in Nova Scotia are nurse practitioners. And despite all this and all the work that nurse practitioners have done, nurse practitioners are well positioned to meet these growing demands and can play a bigger role in expanding access to care and addressing any healthcare gaps.
Amazing. Janet Hazelton from the Nova Scotia Nurses Union recently described the growth of nurse practitioners as unreal in her March 2024 testimony to the Provincial Health Committee. Can you tell us a bit about this growth and maybe what it means to primary care delivery?
So there are currently over 10,000 nurse practitioners in Canada, and we're lucky to have approximately 430 here in Nova Scotia, and this number has doubled since 2020. We have had nurse practitioner here since 2000. Prior to that, they were called extended role nurses, but still functioned in similar ways to nurse practitioners that we have today. We have NPs that work in multitude of practices besides primary care. However, in primary care, they are the most responsible provider, which means that they have a panel of patients around 800 to 1,000 that are registered under that nurse practitioner who acts as their sole primary care provider. That being said, NPs collaborate with other healthcare professionals in order to achieve optimal healthcare. The benefit is that nurse practitioners are independent healthcare practitioners and do not need any oversight. Ideally, we would want more NPs working in primary care to handle that unattached patient list. And in future, this will likely happen, but we need more NPs or more RNs to go into NP programs. And I think, in the future, we'll see more and more of this. We're lucky today. Like when I graduated in 2013, there was only a handful of jobs available, and I was very lucky to get one of those jobs to be able to
Mhm.
stay in Nova Scotia. When I looked on the job market today, there was 53 job postings for nurse practitioners, and 39 of them were in primary care. So I think the future looks really promising for nurse practitioners working in primary care.
Yeah, the demand is definitely high right now.
It is,
Um,
yeah.
let's talk a bit about what the province is doing to increase retention. In 2020, Nova Scotia launched a program funding RNs to complete their NP education at Dalhousie University with a 5-year commitment to work in designated communities. Can you tell us how this program has evolved and maybe what the outcomes have been?
So, in order to be included in the program, registered nurses need to apply to Dalhousie University and be accepted into the full time program. And then, once they're in the program and they're in full time, they then apply to the incentive program. And through the incentive program, it lists where the opportunities are for that year and applications. And the students are able to then apply to the ones that they're looking for, interested in. Um, so they need to be able to commit to the 5 year once they're in the program. Ideally, by choosing a place that they would like to move to, this is helpful. They also need to be in the program full time at Dalhousie. Dalhousie doesn't have any involvement with the incentive program. It is more about like a recruitment strategy through the health authority. My understanding is that the students, if they're accepted into the incentive program, their salary is covered. Up until that point, a lot of students still work full time, which can be very difficult and challenging. Dalhousie has also started some other great initiatives and programs that will improve access to care, such as the RN prescribing program and a mental health certificate that have just recently started.
Nice. Maybe just something off the hook. Why don't you think other provinces are kind of doing something similar to, or maybe they are? Maybe you can expand a little bit on that.
Maybe they are. I'm actually, not familiar with what other provinces are doing. I think the need that we have is we have a lot of areas that are difficult to recruit for that are, Canada's geographically challenged. We are a huge country and provinces, are quite expansive. And so, we have areas that are extremely rural that have found to be difficult to recruit healthcare providers to. And I think this is just one way that the health authority is trying to appetize people to move to these wonderful areas.
Perfect. So Professor Tammy O'Rourke, speaking in January 2023, suggested that NPs could clear probably 50 to 75% of emergency room cases. What's your perspective on the role of NPs in reducing ER pressures, particularly in rural areas?
Well, I think it's a great role for nurse practitioners. We do have several nurse practitioners working in emergency rooms now that are improving access to healthcare and filling healthcare gaps. It is a very appropriate spot for nurse practitioners to work and be able to work to their full scope of practice. What we need is more NPs in these areas to help address like the long wait times in emergency room visits, that can be up to 12 to 18 hours long, like Tammy O'Rourke mentioned. Um, and we are seeing a lot of those postings for NPs in the emergency, like rural area settings, which is very appropriate and much needed.
Nice. We're also seeing interesting NP-led initiatives across Nova Scotia. For example, the IWK Health Centre, they've expanded from one oncology NP to three NPs in the past 3 years. How can this model be expanding NP roles be applied more broadly across the healthcare system?
So we definitely need more initiatives like the three oncology nurses have started at the IWK. MPs that are working, at the forefront of healthcare today have brilliant ideas in terms of, improving access to care, reducing wait lists, and helping improve like and work on these healthcare gaps that we need to be listening to what these nurse practitioners have to say. We need more funding for these ideas. For example, some ideas that could be created is NP-led collaborative clinics, like Tammy O'Rourke mentioned in her uh, letter that would be nice to have NPs leading and most responsible provider with registered nurses, occupational therapists, physiotherapists, dietitians, chiro, and have a really collaborative clinic. Another option is having alternative funding models similarly to what has recently been introduced into Alberta and BC, where NPs can become independent practitioners outside of the health authority and still work in primary care seeing patients. And British Columbia has their own incentive that they'd started where we have NP governance, where NPs are leading the way for other MPs and making decisions around NP practice.
Nice. Let's discuss maybe some workplace challenges. In March 2024, the Health Committee meeting highlighted concerns about workplace violence and burnout in healthcare. How are these issues affecting NPs and what solutions are being proposed? What needs to be different this time for it to succeed?
So, we are seeing a lot of burnout with all healthcare professionals, and I think NPs, particularly in primary care, are facing this challenge a lot. There is a lot of concerns NPs are facing around administrative burden. Many are experiencing unnecessary red tape and micromanagement by healthcare administrators that are preventing them from maximizing their impact on the healthcare system. And I think the solutions is what we talked about earlier in terms of NP-led clinics, NP governance, and alternative funding models for NPs, where I think the satisfaction and job life equality will happen, and NPs are able to make decisions for NPs.
Nice. Looking ahead, what key changes are needed to optimize the role of nurse practitioners in Nova Scotia's healthcare system?
I think in order to recruit and to retain more nurse practitioners here in Nova Scotia, besides that, we have, a beautiful landscape. We have amazing, kind people here in Nova Scotia that any healthcare provider would be happy to provide care for. We need to remove the barriers that NPs are currently facing in the healthcare system, such as that unnecessary red tape and micromanaging by administration. And we need NPs governing NPs. I think, is a very extremely important.
Mhm. To wrap up, what's your final message you would like to share with Nova Scotians about the future of nurse practitioners in this province?
So I think the main message is kind of, I guess, a couple things, maybe not a main message, but maybe a couple, and that we want residents of Nova Scotia to really understand the positive impacts that nurse practitioners can have on health outcomes. And we believe that every Nova Scotia resident should have the opportunity to have a nurse practitioner involved in their care.
Great. Thank you. Thank you, April, for sharing your insights about the healthcare landscape in Nova Scotia. We really appreciate your time with us today.
Thank you. I really appreciate the invite. It was great meeting you.
Thank you. And then, so to our listeners, thank you for joining us for another episode of Prescription for Primary Care. We hope this episode has shed some light on the crucial role of nurse practitioners in addressing Nova Scotia's primary care challenges. Until next time, good health and better healthcare.